Hi everyone, it's Angela here from Gracefield Physio Pain Slayers, and I have our newest pain slayer here with me, Joni. So Joni's now been with us for a few weeks, but I thought we might get to know Joni a little bit more. So Joni, what sort of things are you interested in treating?
Well, I guess naturally, because I enjoy running and cycling, so I enjoy treating lots of different leg injuries of people who are runners and cyclists, but I like seeing everything really, legs, arms, necks, backs, you name it. Also like treating vertigo or any dizziness complaints, and also anyone who has jaw pain as well is some of the things I enjoy treating.
So go back to the running and the cycling. So you do a bit of running and cycling yourself?
Yeah.
Yep. So I suppose, have you had any injuries yourself that made you interested in more in like running injuries or cycling injuries?
I'd like to think I haven't had any major injuries because of my knowledge as a physio and treating the condition, but I think my interest just comes from purely the fact that I enjoy it so much, and I want to see everyone out there enjoying running and cycling as much as I do.
Okay, and so if you watch somebody who's come in with a running injury, like, do you have a look at how they run?
Yeah, absolutely. Yeah, it's one of the most important things. If someone's come in with a running related injury, there's often something about the way that they're running or how much they're doing, which is the reason why they've caused the injury, and so that's definitely something that I like to look at.
Yeah, so you can see by how they run as to what they might have done to themselves if they pull up.
Absolutely.
Yeah.
Yep.
And then what about the cycling? Because I know it's really important to make sure that you've got a bike that actually fits you properly.
Yeah, so it's actually quite similar running and cycling, that it can be the way that you're cycling or how much cycling you're doing that can be that can lead to an injury potentially. So it's something that I do like to get people in here. They can bring their bikes in and we can have a look and get them set up on their bike and make a few adjustments and see if that makes it feel a bit easier for them to ride.
Yeah, because I know I've spoken to a lot of people even that go to a gym and do RPM classes, and they come to physio with a sore pelvis or sore lower back or sore neck just because of the positioning of themselves on the bike.
Yeah.
So you could probably even teach them how to position their bike properly as well.
Yeah.
So we do have a bike here.
Yes.
But and then the other two things that you mentioned that are sort of more specialty areas as well are the vertigo and TMJ, which is jaw pain. So have you, like, with your jaw pain things, like, have you been working with dentists in the past, or?
I think it's probably just come from jaw pain's an area that not a lot of physios, I guess, feel overly comfortable treating.
Yep.
And it's something that I've always just found has been a nice challenge for me and a special interest. I couldn't tell you why. I think it's just a nice little niche area that I find interesting, and all the little muscles that work around the jaw and how the neck can be involved as well. And I guess that's where my interest has come from.
Yeah, because I've heard that sometimes there is definitely a neck component to somebody with jaw pain.
Absolutely, yeah.
And then the other area that's quite interesting, and we've seen a lot of it through the clinic lately, is vertigo, because some people don't actually realise that you can treat people for like that benign paroxysmal positional vertigo.
That's right, and I think once again it's an area that not a lot of physios feel comfortable treating, and it's something that I always used to think, wow, that's pretty cool that we can treat that, and so it is nice, and someone can come in feeling absolutely horrible with their dizziness and their vertigo, and they can literally walk out feeling 100%, which I think is pretty cool.
Which that means you've slayed their vertigo pain very quickly.
That's right.
So that's good, Joni. So there's a lot of different niche sort of areas that you have some sort of special interests and experience in, so that's great. So we welcome Joni to our team. So if you have any problems with your running or your cycling or vertigo or TMJ, which is jaw pain, Joni can definitely help with any of those injuries in the clinic.